Hello everyone, my name is Soran and I'll be doing my presentation on cystic fibrosis. Let's begin with the terminology. The term is pronounced as cystic fibrosis. Looking at the chart for word parts and meanings, cyst means sac, ic means pertaining to, fibr means fiber, and osis means condition. Our textbook defines cystic fibrosis as scarring, fibrosis, and formation of cyst in the pancreas. We can see signs of fibrosis in the shown picture. Let's learn more about cystic fibrosis. What is cystic fibrosis? Cystic fibrosis is an inherited life-threatening disorder which causes severe damage to the lungs and the digestive system. What are the causes of cystic fibrosis? Cystic fibrosis, or CF, is caused by a mutation in a gene called the cystic fibrosis transmembrane conductance regulator, or CFTR for short. This gene is found on chromosome 7, and as we can see from the picture shown, in patients with CF, the nucleotides CTT in the second and third codon that translate to amino acids isoleucine 507 and phenylalanine 508 are deleted. So what are the functions of CFTR? This gene codes for proteins that go to the surface of the cells that line the pancreatic duct, airways, GI tract, biliary duct, parts of male reproductive tracts, and cells that are part of sweat glands. This gene also creates a channel that allows ions like chloride and bicarbonate to move from one side of the cell membrane to the other. The movements of ions changes the concentration of the molecules within the ducts that the cells are lining, and this change results in pancreatic fluid secretion, moistening of the airway lining, movement of digestive juices, and sweating on the skin. So what happens when CFTR is dysfunctional by mutation? A normal functioning CFTR channel moves chloride ions to the outside of the cell, while a mutant CFTR channel doesn't, causing a sticky mucus to build up on the outside of the cell. How is this gene passed on? CFTR is a recessive gene, and a child needs to inherit one copy of the gene from each parent in order to have cystic fibrosis. Let's take a look at some symptoms. CF affects the entire body. However, it mainly targets the respiratory system and the digestive system. In patients with CF, the built-up thick mucus clogs the tubes carrying air. Some respiratory symptoms include persistent cough with thick sputum, wheezing, shortness of breath, repeated lung infections, and nose congestion. Cystic fibrosis also clogs the tubes that carry digestive enzymes from pancreas to the small intestine, and its symptoms are very poor digestion, poor weight gain and growth, severe and painful constipation. And also in newborns, there's also intestinal blockage called meconium ileus. How is cystic fibrosis diagnosed? Early diagnosis of CF is followed by immediate treatment plan. The most common diagnosis procedure is performing a sweat test on a newborn. A sweat-producing chemical is applied on an area of the skin, and an electrode is connected. Baby sweats, and the sample is collected. Then, the lab checks for the amount of chloride in the sweat. Babies with CF have more chloride, or salt, in their sweat. This picture shows the simple process for sweat testing on a newborn. Genetic testing is also available to determine the carrier for CF, or it is used to confirm the disorder. Are there any treatments for CF? Sadly, there is no cure for cystic fibrosis, but it is medically manageable. Treatment plans can reduce the disease complications and ease the symptoms. Antibiotics are used to prevent lung infections. Some examples include ciprofloxacin, azithromycin, or gentamicin by injection. There's also mucus thinning drugs available that help with coughing up mucus, bronchodilators that relax muscles around the bronchial tube, helping airways to stay open, and oral pancreatic enzymes that help with nutrient absorption. Lastly, the specialists who work in treating patients with cystic fibrosis include pulmonologists, gastroenterologists, nutritionists, pediatricians, and medical geneticists. Thank you for reviewing my presentation, and good luck on the finals.